All right. Hi, I'm Matthew Hong, and today I'll be introducing the NLP intern group on semantic representation and temporal reasoning. We have 4 interns working on this project under the supervision of Dr. Wendy Chapman, including myself, Tao, Jianlin, and Emily. And all interns will be presenting in this order. So you might wonder, what is NLP? What is a natural language processing system? Well, quite literally put, it is a discipline that provides a set of techniques or methods for processing natural language, which is free text. And in the field of medicine, physicians or researchers alike still read through hundreds, if not thousands, of patient records to look for the information that they want. And what NLP does here then is to automatically extract and structure clinical data and help these people do their jobs. And my contribution to this project is to study the users of this system and to provide implications for a user intuitive toolkit called Schema Builder. And so it's my project title, User Studies for Schema Builder. Okay, so in this presentation, I'll be talking about the motivation for Schema Builder and why and how we did the user studies. And I'll be presenting some findings from these studies. And I'll conclude with some mock-ups of the Schema Builder. So why is it important to have a user schema? Well, in order to answer this question, we need to first look at the problems with the clinical data today. So the first problem is that there's just too much information that clinical professions have to deal with. And this can go up to 10,000 pages of patient records in a single Word document. And because all of these records are written in free text, a lot of the information is highly unstructured or unorganized. So sometimes the dates and names are in the wrong place, or the information can be duplicated somewhere else. And last but not least, not all information is relevant to the needs of the specific user. So in order to address these problems, it will be necessary to provide the user with some form of front end or a user interface that'll help them build or customize an NLP schema for extracting and structuring relevant information. And so we know that there is a problem and something has to be done about it, but it'll be meaningless to build an interface before we know anything about the users themselves. And the point I'm trying to make here is that that understanding the user is more valuable than building the interface. So we raised 3 questions. Who will be using Schema Builder? Who are the prospective users of Schema Builder? And what kind of physicians or researchers will be interested in using this tool? And what are their use cases? And the second question we raised was, what do they know? And this is an important question to ask because what their understanding of the clinical data can vary. And we want to know how their understanding of medical knowledge differs from our understanding of the NLP system. And so the things that we're interested in knowing is, what are the categories of concepts that they use? And what are the individual attributes that are attached to these concepts? And finally, we want to know, what do the users want to see as a final output? Do they want to see a form, a flow diagram, a timeline, or does it have to be interactive? And so to answer these questions, we conducted 30-minute task-oriented interviews that lasted for 3 sessions. And for the given time frame, we were able to get in touch with 2 study participants, both physicians who were representative of 2 use cases. So those were the adverse drug events use case and the colonoscopy exam use case. And we'll be exploring bleeding events in the future. And so we were mainly interested in our users' understanding of the medical knowledge and that are associated with these, and to align that with our understanding of the NLP model, we asked them to map each category of medical concepts on the left column to the qualitative modifiers on the right. That can be assigned to each concept. And what we found from these studies is that users tend to organize these concepts under three broad categories, which are background, problems, and actions. And if we zoom in further, you'll see the more specific concept categories that are associated with these containers. And although these concepts might differ depending on the use case and the wordings can be different, we believe these containers are sufficient for capturing the essence of most medical concepts. And as a result of the user tests I mentioned earlier, we were able to identify most of the concept to attribute pairings. And so once these relations are in line, and since these relations are specified by the user, the most relevant information can be delivered to the user. And during these studies, we also asked, what do the users want to see as an output? And again, this depended on the use case. So for the colonoscopy use case, the user was most interested in seeing a list of things to be marked off when they were done. So a form like this might suit the needs of this user. And whereas for the adverse drug events, the user was more interested in seeing the temporal order of events in relation to the administration of a drug while the patient is hospitalized. So an interactive visualization of a timeline will be more suited. And it'll be helpful for quickly recognizing event patterns and navigating patient record history. And so in the end, we've learned what are the categories of information that are relevant or that are important for our target users. And these included the three containers, the background, problems, and actions, and the other concept categories that are specified by the users. And also, we learned the types of attributes that are associated with these concepts. And finally, we learned how we can display the NLP extracted information to assist in the workflow of their research. So in the future, in the near future, we would like to do more of these studies and finalize on the mock-ups through iterative design process, and also to link the NLP system to the user display such that when the NLP automatically fills in the information from the extracted clinical patient records, the users can have total control over the delivered information. And so I would like to acknowledge Dr. Wendy Chapman again for mentoring this project, and our study participants and collaborators and Qualitative, IDASH and DBMI, and NIH and NLM for funding this study. Thank you.
I'd like to invite the next speaker down. We have time for a question. Thanks, Matthew. Just go under view and go enter full screen. Yeah. And then we're done with the PDF. It'll still be. Okay. Just remember to talk right.
Hi. Hello, my name is Tao Wang. I'm a PhD student from UC Irvine. So my project is to explore interface design for clinical temporal data. This project is supervised by Professor Wendy Chapman and also Robert Alteri. So I need to point out, so this project is starting from June 25 and it will finish in September 12. So that means that we still have some work ongoing at the moment. So now let's go back to the big picture for a moment. So Matt just talked about Schema Builder. Schema Builder will help a non-expert user to come up with the schema, and then the NLP algorithm will be able to use the schema to extract useful information. And then we need to find out a good way to present that information back to the user. So that is the focus of my project. In this presentation, I'll start talking about why we think clinical data temporality is an intriguing topic. And then I will give you a very brief summary of current work in this domain. And then I'll describe our project and show you a quick demo. Finally, I'll finish with our progress and future plan. So this project is driven by the potential of better understanding of clinical data's temporality can bring to EMR systems. The move from paper record to electronic medical record allows the easier and faster access to patient information. However, the difficulty in information consumption is still there. Matt already talked about all those challenges. The challenge of understanding medical information often rests on the nature of clinical data. So this is where the temporality analysis can help. Temporal order often reveal the underlying logical connections, so that can help a doctor to get the more complete picture of what's going on and also facilitate reasoning. So the prior work in this domain can be classified into two groups. First is the system that deal with the absolute temporal information. These systems often adopt a horizontal timeline metaphor, and they often provide some intelligent feature to interpret the data. Another group of study is often deal with the relative temporal information, and these kind of study often based on natural language, and they focus on classify even two semantic groups, and then trying to visualize the semantic relationship. And in terms of data, they often, both kind of study, they deal with both the quantitative data and the qualitative data. So here is an example of a system dealing with the absolute temporal data. It's called Lifelines. It was built in the middle 90s. It's one of the early attempts in this domain. As we can see, the system has the patient information displayed on horizontal timelines, and the user can navigate left or right to go through time. And this one's called V-model, is an example of a system based on relative temporal data. In this visualization, the hospital visits spread on the horizontal timeline, we can see here. And each visit can serve as an anchor of a V-model instance. A complete V-model instance has two wings. The left wing summarizes the problem, and the right wing summarizes the actions. So this technique brings temporal order and underlying logical connection together very nicely. So in our work, based on what others have done and the discussion with our expert users, we set up a few goals. From interface perspective, we want to integrate the qualitative data with quantitative data and integrate relative temporal information with absolute temporal information. Our user have pointed out, in different scenarios often demands different kind of interface. So we think it's very important to allow the user to customize the interface to what they need. And also a lot of information makes more sense in the context. So we want to extract the key idea, but still maintain the original context. From an intelligence perspective, we think the system should help user to see, but not really telling the user what's there to be seen. And then finally, as a research tool, we hope the system can be easily configured working with other EMR system and research tools. So currently, our implementation effort is focused on building a baseline prototype. And on the left-hand side, you can see a breaking down of how some features matching with our goals. The feature and design currently are based on our expert users' prior work and the project group discussion. At this stage, we deal with a single report, free text, and the annotation is done by manually by a human annotator. So now I'm going to show you a quick demo. This page is a single patient discharge report. As we can see, it's packed with information. So often a clinician will have to read through carefully. However, based on a NLP annotated version, which is not shown on the page, we generate a visualization at the bottom. The NLP classifies data into 4 groups. So that's event, problem, test, and treatment. So our system generates these checkboxes accordingly. Each piece of data is also classified into one of the 3 course time bins. So that's past, current, and future. And with this information, a visual timeline is created. Each item in the bin is labeled by a keyword. This allows users to get a quick idea what the report is talking about. To find out more details, the user can locate the original context by hovering the mouse over the item. The source text will be highlighted in the original report. There are many sophisticated features embedded in the patient report. For example, denies chest pain. Okay, it doesn't show up. So that means there's no chest pain, but the fact that that's not there is useful. So we have this icon in the bin item to indicate this kind of negation. In this report, we only have about 15 items. So, but normally in a real patient report can easily contain hundreds of pieces of information. In that case, the user can check or uncheck some data type to focus on only relevant information. So we are still working on the search feature, which will further filter the data. And another ongoing development is the zooming feature. So far, we have reviewed the literature and built a baseline system. In the remaining 4 weeks of my project, I'm working with our user to refine the existing features and develop some new features based on our user study result. We also plan to run some system evaluation with a few users. And beyond this summer, with the baseline implementation, we can start exploring more complicated questions. For example, what would be the best way to present an event that happened at a point of time versus chronic events? And how can we provide an interface for users to enter relative temporal event with absolute temporal event, which will further improve the temporality granularity? So all our intriguing and interesting question. So finally, I want to thank our collaborator, users, Tao IT2 DBMI for organizing the internship, and also NIH NLM for the funding. Thank you very much.
Okay, I'd like to invite our next speaker up. Are there any questions? Okay, thanks.
Hi, good afternoon. I'm Jianlin. And thank you for giving me this opportunity to talk about my work. My supervisor is Professor Wendy Chapman and Dr. Robert N. Carey. So I'm going to talk about the user study of this timeline project to understand how clinicians would like to visualize a patient medical course. Tao and Masu have introduced the overview of this project and the main ideas. So my part of work is involved 3 parts: users, medical records, and the user interface. Now you may ask, how could I get started with this kind of application, design this application? So the first we have to answer 2 questions. What content do physicians want to see on a timeline? And what is the best way to visualize this kind of information? To answer these 2 questions, we go over the literature reviews, and we found there's some similar studies. They have reached some common views about the user tasks, such as doctors want to get an overview of patient data, and doctors want to find out the relationships in patient data. Also, there are some common agreements about the requirements, such as the flexibility to support the display different kind of variables from the medical records. Also, the interactive features should be included, such as zooming, filtering, grouping, etc. But we feel that this information or these findings is not enough for us to conduct this kind of design application. So we decided to do our own user study. So our approach would be illustrated through this diagram. First, we want to know what is wanted through literature review and interviews. And then we will analyze the data we collected from the interview, doing some, identify the scenarios that this kind of application would be helpful to the doctors. Within each scenarios, we can identify the specific tasks that the doctor wants to accomplish. Then, through a iterative process, we come up with some kind of design and then re-evaluate it and analysis again. After that, then we can come up with some relatively matured design ideas and implement a prototype system. So we have finished the literature review, and then we will conduct an interview. So we focused on the physicians at UCSD. We conduct a semi-structured interview. In the interview, we provide them a sample medical record and ask them to summarize the information and sketch out how would it express and organize the information in their mind. And then we will ask them the questions based on what they draw and the ideas they're trying to convey. So from the interview, we find that there are 3 types of scenarios that would be used to use this kind of application, the timeline. The first one is when doctor diagnoses a patient. The second one is when doctor management a patient disease. The last one is when doctor try to summarize a treatment course. In the diagnosis scenario, basically they just try to find a diagnosis that can explain all the problems that happen to this patient, so that they probably don't want to miss anything. One doctor mentioned that, give us an example, when he's trying to diagnose a child patient with asthma, probably a symptom does not relate to asthma still makes sense. For example, the vomiting will suggest that the diagnosis should be pneumonia instead of asthma. And even some negative symptoms or laboratory results could be significant. Also, just several doctors have mentioned that in their minds, the treatment course could be separated into 3 periods for the past history, present history, and future plans. In the management scenario, doctors want to find out the response of the patient to the treatment. They need to know whether the treatment needs to be adjusted or not. So this would suggest that any kind of design or application could help them to identify the relationship between the treatment and the response would be helpful. In the summarized scenario, the doctors will need to provide a summary of the treatment course during a certain period of time when they hand out the patient care to another physicians. So they basically, they just focus on the main issues, not care too much about details. In the interview, they also expressed some very interesting ideas that how they would like to represent that kind of the medical information. The first one is different views are helpful. For example, one doctor mentioned that a SOAP categorization would be helpful because the SOAP means subjective, objective, assessment, and plan. That is all usually the doctors how organize the information in their mind. And another doctor mentioned that a vertical view would be helpful because the vertical view is coherent to the original arrangement of the medical records, and it's more extensive to display the information horizontally. Radiologists suggest that a body location view would be helpful because he usually think the relative information within a body location, such as a shoulder. So we have just mentioned that for the zooming feature is important feature for this kind of application. But in order to implement that feature, we have to deal with that what kind of information should be displayed differently in depth within different time range. So one doctor explained his requirement that in the most zoom-in view, he would like to show the very detailed information, such as including some attributes. For example, like the chest pain is getting worse. But if we zoomed out a little bit, he would think that maybe just a few concepts that it would be enough. For example, just the chest pain. And if we view that information through a long time, for example, like decades, probably he would just only consider to view the diagnosis and the hospitalization. That will be a good suggestion for us to design this kind of application. So that is something important we have learned from the user study. And next, we're going to go through this literate process to refine our design ideas and finally accomplish a prototype system. I would like to thank my supervisor and collaborators, and also the users take part in our interviews. Thank Qualitative to offer me this place to work. Thank ADASH and DBMA to provide this opportunity for me. And thank NIH to provide funding for this project. Thank you. Any questions? Any questions?
Okay, come on down.
Okay. Hi, I'm Emily Silgard. I'm working on my master's in computational linguistics at the University of Washington. And I've been working with Rutu Mogameta and Wendy Chapman this summer on temporal extraction from clinical discharge summaries. So I'm going to tell you a little bit about how my work in NLP can kind of fit into this larger project. I'm going to start out by talking about how challenging the task really is. I'll tell you about our work on this task within the framework of the I2B2 challenge this summer. For anyone that's not familiar with them, they're a national biomedical computing center, a little bit like IDASH. And I'm going to show you what I think are some pretty impressive results, or at least very promising. So extracting temporal relations from raw text is by no means a trivial task. Some people reported that annotator agreement is around 55%. So it should give you an idea that even for humans, it's pretty complex. And to date, minimal work has been done in biomedical informatics and temporal representation and reasoning. So one of the reasons it's difficult is that human language is varied. There's a huge diversity in temporal expressions. So even if you're representing something as seemingly straightforward as a date, there's a huge variety in formatting. Also, natural language is very ambiguous. So these are some just pretty simple examples of that. Is 1204 December 4th or December 2004? That's something that you might be able to figure out from context, from reading through the whole document. It's going to be a little bit harder to develop an algorithm that can figure that out on the fly. Is the last month the last calendar month, or is it the last 30 days leading up until today? Also something you might be able to discern from context, but developing an algorithm that can figure that out precisely to be able to model things on a timeline is tricky. Also, we have a lot of temporal expressions that are relative, things like 2 weeks ago or for the past 3 years. And that requires a little bit of context to figure out when that time actually is. Also, determining temporal relations among events can be complex. Sometimes you need a lot of real-world knowledge, even deep semantic knowledge. Sometimes, in this domain, you even need specific medical knowledge. So in a sentence like this, the patient has a history of multiple infarctions, recent surgery, and chronic pain. How would you relate these events in time? Think about how much reasoning and context goes into deciding when exactly those things occur. Also, another thing that makes this challenging is that time isn't really discrete. It's a continuous thing that we just kind of impose these discrete values on, and they all have varying intervals. So within the same document, even within the same sentence, like the patient had surgery last October, was admitted 12/4/2009, transferred to the ER at 6 p.m. We have a wide variety of temporal granularity, and reasoning within that granularity or modeling it can be difficult. So we've been working on this problem in the context of the I2B2 challenge. Our training data is 190 discharge summaries, which have been annotated with medical events, temporal expressions, and temporal relations. We got our training data June 15th, and we just got the testing data on August 8th. So now the testing data doesn't have those temporal relations in it. Our job is to take our medical events, those temporal expressions, and try to figure out how they relate to each other in time. And the results are due today. So clinical data is somewhat structured. Of course, there's natural language within that data that is not really that structured. But for our purposes, it's kind of an example of a clinical discharge summary. So you have an admission date and discharge date, which act as really important temporal anchors to the rest of the clinical narrative. A patient history, in which the majority of the events mentioned usually occur before admission, and a hospital course, where the majority of events that are mentioned usually occur before discharge. And so we took advantage of the limited structure that is in the data and the patterns that occur in natural language to create 3 parallel rule-based systems. So the first one helps to anchor events to the admission and discharge dates. The second one attempts to identify possible co-references, so words that are probably referring to the same event, even though they're mentioned in different places. And then a third that looks for common temporal markers and patterns, so X after Y, or patient continued on X for Y, things like that. And then we used several machine learning techniques to try to classify components within the same sentence. So we worked primarily with maximum entropy and naive Bayes. And I'm just going to kind of walk through a little bit of an example to help you visualize what's going on here. So the idea is that hopefully you're teaching this algorithm to learn the attributes of the events and the attributes of the sentence that they're in, so that it can figure out how to place these things on a timeline. So in 1092, she had a CT scan, which showed fatty infiltration and a cyst. So hopefully we're learning that October is an interval of time on our timeline. The CT scan happened in October. And if it showed fatty infiltration, that means that was existed before the CT scan. And without more information, we're going to assume that cyst is basically overlapping roughly the same time period. And hopefully in the end, you end up with at least a relative ordering of events. So our final score for the competition will be our F score, which has been talked about a little bit today, but for anyone that's not familiar with that, it's going to be a combination of precision and recall. So for example, if you had a quiz with 10 questions and you only attempted to answer 5 of them, but you got 4 of them right, then your precision would be 4 out of 5, 80%. Your recall would be 4 out of 10, 40%. They're both really important ways to measure things, and you can kind of tweak your system to develop it to be more precise or have better recall depending on what's more important for your application. So we've created a couple different systems, and we can submit up to 3 for the competition. So by combining these components in different ways, different classifiers, we created a high precision system and a high recall system. And I think they work pretty well, especially compared to that human inter-annotator agreement. So I'd really like to thank IDASH, NIH, UCSD, and Bioinformatics for having me down this summer. It's been a lot of fun kind of delving into the world of temporal relations. I2B2, I'm sure they're not watching, but for helping me bring out my competitive side. And Wendy Chapman and Ritu Mukul Mehta for working with me this summer. And Melissa, Alan, and Ruth, who all worked together with us on the I2B2 project. Any questions?